My name is Andrew Pastor. I'm an orthopedic surgeon at the Everett Clinic. I chose shoulder surgery because it is a very complex joint, and when I was in residency and I was learning about it, I was just fascinated by how many moving parts are involved in the shoulder and how small things going wrong can cause such big issues, and the different techniques and equipment you can use to fix the shoulder. So patients that come to me for a shoulder replacement have a diagnosis of shoulder arthritis. And what arthritis is really a degradation of the cartilage, or that little padding, the smooth padding at the end of your bone. And over time, whether it be from an injury or from inflammation, infection, that cartilage can actually wear down, where people especially have bone-on-bone, we call bone-on-bone arthritis. Their bones rubbing on bone, and that really hurts. So our goal is to try to relieve that pain. Some of the treatments we try for shoulder arthritis before I really start talking about a shoulder replacement includes physical therapy, injections sometimes, steroid injections into the shoulder, activity modification and things of that nature. When those fail, then we start really talking about whether a shoulder replacement is the right choice for them. So there are two main types of shoulder replacements. There's the regular, we call an anatomic shoulder replacement, and there's a reverse shoulder replacement. The decision on what a patient needs really is based on the rotator cuff. Patients that have shoulder arthritis and a big rotator cuff tear actually get what we call the reverse shoulder replacement. Patients that just have shoulder arthritis are candidates for an anatomic shoulder replacement. An anatomic shoulder replacement involves replacing the surfaces of both the ball and the socket of the shoulder. So with shoulder arthritis, the ball portion loses its cartilage, and then the socket portion, which is inside, loses its cartilage also. So what we have to do is replace that. So what we do is you take a small cut you take off the arthritic portion of the ball, and what that does is it leaves you something about like this. So you replace that arthritic portion of the ball with a metal ball, and that metal ball is attached to a stem that goes in the hollow part of the bone, and it just sits about like that. So that now you have a new surface of the humerus. Now on the socket side, you actually just use a bone glue or we call bone cement, and you actually put a piece of plastic there. So instead of having bone on bone, now you have a metal on plastic joint that works really nicely. So a reverse shoulder replacement is a very special type of shoulder replacement for patients that have both arthritis and a big rotator cuff tear. The reason we have to reverse it is because the rotator cuff's main role is to hold the ball into the center of the socket. If the rotator cuff is not working, then the ball actually raises up, and if you put a regular shoulder replacement, the plastic piece will actually get dislodged. So they developed what's called the reverse shoulder replacement. What that involves is, just like I said, it's reverse. You actually screw the ball portion onto the socket side. This is a shoulder blade, and this is the socket side. And on the other side, on the humerus side, you put the cup. So it sits like this, and that holds the ball into the right position. The overall recovery for an anatomic shoulder replacement, I usually tell patients, is about 4 to 6 months total. I actually want people to start their rehab exercises the night of surgery or the day after surgery, working on shoulder range of motions and things of that nature. For about the first 6 weeks or so, they're working on their motion, and that's a really tough time for them. I would expect them to be back to driving and doing daily activities within that first 6 weeks for sure. Returning to regular sports, golf, things of that nature usually takes about 6 months. The recovery for a reverse shoulder replacement is a little different than an anatomic shoulder replacement. For the first 6 weeks, I have patients in a sling because we have to be very careful that the tissues heal around the shoulder replacement. Then we start physical therapy and get them back to doing their regular activities. Usually it takes about 6 months. So generally speaking, I like to see patients at different intervals during surgery. I see them right after surgery, usually about 2 weeks, to check on their incision, make sure everything's healing properly. For an anatomic shoulder replacement, I like to see how they're doing with their physical therapy at that time. For the patients with a reverse shoulder replacement, we start planning for physical therapy. I see them back again at 6 weeks, at 12 weeks, and then usually every couple months for the first 6 months. Both myself and our surgical team's always available for patients after a shoulder replacement. If they have questions about therapy, about pain control, about any concerns at all, we're always available to take care of them.